Good morning. We are a clinic in Verona, and our center of excellence is orthopedic surgery. We were the first to introduce this kind of surgery in 2011. This robotic surgery for orthopedics, right now due for hip and knee surgery, comes from US, and it's been introduced in Italy and Europe for the first time from Dr. Perazzini in January 2011. This kind of surgery gives us an opportunity to face to this market and this fair and try to look if we are ready and which are the opportunity that we can try. So insurance, so facilitators, and this is what a clinic, a small clinic, needs to face this market. So we have the technology, we have the professional surgeon ready to do that, but we need help and we need to find how to face this opportunity.
How many clinics in Europe work like you do?
In Italy there are 8 structures. In Europe I think around 15.
Okay, so it's not so
Yes,
common.
it's not so common, but we did more than 50% of the surgery in Italy comes from our clinic. So I think that around the world it's there are a lot of like 200 robots like ours, but for the Europe we are really competitive, so we are ready to start this experience.
You already work with foreign patients?
We had few cases of international patients, more European patients, because they know about the technique and with our website. So website is the first show that you need to have. But patients right now are ready to learn, and they are really interested in about new technology. So I think that right now comes from patients the interest for new technology and good services.
So your main channel is currently the web, so patients.
Yes.
Okay. And do you also have doctors referring patients from abroad, or usually it's a self-made search from the patient himself?
Right now it's self-search made. So that's why I think for the medical tourism it would be great if there are a referral website or blog or something that can give more information to the patients. So I think right now it's all made by patients.
Okay. And where do your foreign patients come from, mainly?
They come from UK, from Germany. So we had few cases, because right now this technology is only at the university in UK, so they are not on the market right now. So they are looking for us.
And what are the main challenges you face when dealing with foreign patients?
I think all the services around the patients, because inside the clinic everything is settled for patient, could be Italian or foreign, is not a problem. Our surgeon and nurses, everything is settled. But the extra services and the expectation of the patients, that's the real challenge to understand. It depends from where they come and what they need, except of course the surgery.
Okay. So what are your main needs from the rest of the value chain?
I think all the services like travel, like the flight, like the help for the patient to arrive to the clinic, and after the clinic, after the surgery, what to do, like organize events like tourism. That's why the medical tourism, it's a really big challenge, but they need people look for that. Like after the surgery, you have a fast discharge. So what we can do? You can go visiting our city. I think there are different needs, but.
But I think that your patients after the discharge cannot just go and walk around Verona.
Yes, after 4 days.
So maybe they need also some kind of assistance, and they need.
Absolutely.
Okay, so Yes, one of the things, so you would need to find a partner, like a tour operator or a travel agency, maybe you can, with whom you can start a cooperation and deal the incoming. Is it a patient like someone who is going to Sharm el Sheikh, the client who comes to you, or do you think that the agency taking care of your patients should also have a special training on this patient's need in order to offer suitable packages or assistance?
I think, yes, it could be a good idea to have a package of all, from the surgery to the rehabilitation, and after, of course, all the needs of the patient. I think that orthopedic patients can be different, depends on the age, but are extremely easy patients because they can walk by themselves. So I think that the help from the tour operator could be really useful, and also part of the needs of the clinic is also a service of interpreting. If for a patient, like example from Russia or from other country, that it's a really different language. So I think that could be a good idea.
So what you need from an operator should be more a kind of concierge service than a classic, let's say, and we will talk with Mr. Filippetti after, than classic tour operator or travel agent service.
Yes.
Okay. Deborah, yes? Deborah Duncan from Salus Gate, who is a facilitator.
I would like to know, you said that you have all the people in charge when they start the process inside the hospital or the clinic. So you have somebody 24/7 that look after the customer, international customer, because the Italian customer, it's easy to manage them because they can speak easily our language. So, but for the English or Spanish or German, they found really, if you think about, if you go to another country and then you don't know the language and you feel like a bit lost inside the hospital, even if you have a wonderful room, a wonderful site. So this is my main point, because my experience shows me that most of the people that I took even from UK to Italy, they did find really helpful to have somebody just nearby them and took them for all the process. Because we are in Italy, we speak Italian, we don't think how important are this part and how important is also to consider the cultural point of view. So we have a lot of differences. As an example, it could be like weight. I mean, in England, you don't weigh as a kilo, and you have to consider that point.
Yes.
It looks like not an important point, but if you have an English person and you just say, okay, you are in a checkup, you are doing something for. So they weigh you and they say, okay, 55 kilo, and they are looking at you as, what is it? I don't understand what's this. So even this kind of, and there are some others important things that you have to consider, because people maybe, they would like to have a different kind of rooms, that they need maybe, I don't know, some suite, because they need to have the family nearby. So just to know, you are already organized on this side, or you are looking for to have somebody as us?
We are looking for somebody like you, because I think that to be ready to help the patient, because at the end the most important thing is the patient experience. Is not only, of course, to medical tourism, it's something that can be the best experience that someone needs, but first of all is the healthcare. So absolutely someone who can help us, because if we were a big hospital, we could, introduce by ourselves someone inside 24 hours for 7 days, and what you said before, it's really true. But right now we are not at that point. We are starting to this experience and look if we are ready.
Okay,
Thank you.
We are here for you.
Thank you.
Okay, so let's leave the new business part afterwards.
Can I quickly latch on to that point?
Yep.
I think you've touched upon something very important, which is not only about the patient themselves, but it's actually about the people accompanying the patient. So once the patient enters the hospital and there is the international unit which takes care of the patient and so on, I believe that most hospitals will do this properly and will treat the foreign patient as well as, if not even with more silk gloves than a local patient, simply because this is a new niche area that one wants to develop. However, we need to also focus on the fact of who is accompanying. If it is especially the first time that these people are coming into a country, maybe it's a city they're not familiar with, it's a language that is a barrier to them, maybe even from a dietary point of view, etc. The minute the patient is in the hospital, at least they're cared for 24/7 and there's a system. But I think one of the important roles of the facilitator is also to help the family, also giving the peace of mind to the patient that whilst they are undergoing the intervention, there's actually somebody caring for the family who are awaiting, with apprehension, the outcome and the results of whatever intervention it is. So I just wanted to close the picture there.
Thanks, Claire.